All right, let's talk about something that almost everyone has experienced, and something that can definitely cause a little bit of anxiety: swollen glands. You find a lump and your mind just starts racing. Today, we're going to demystify the whole thing: what they are, why they pop up, and what your body's actually trying to tell you.
I mean, who hasn't been there, right? You're just minding your own business, maybe in the shower, and you feel it, a small lump in your neck or under your arm, and bam, the worry kicks in. But the goal here is to trade that worry for some real, solid understanding of what's going on under the skin. So let's start with the basics.
So, if you go to a doctor, you might hear them use a fancy word: lymphadenopathy. It sounds complicated, but it's really not. All it means is that your lymph nodes feel different. Maybe they're bigger or their texture has changed. The key thing to get is that it's a symptom, a clue that something's up, not the final diagnosis itself.
To really get what's happening, you gotta have a good mental picture. So think about it like this. Your body has this huge network, kind of like a highway system, called the lymphatic system. And all along these highways, there are hundreds of little security checkpoints or filter stations. Those are your lymph nodes.
Okay, so what happens when a bad guy, let's say a virus or some bacteria, tries to cruise down that highway? Well, it gets stopped at the checkpoint. The alarm goes off, and your immune cells, your body's security guards, they all get activated. They start multiplying like crazy inside that little node to build an army and fight off the invader. And all that action, all those new cells, makes the node swell up. It's literally a sign that your immune system is fired up and doing its job.
So that brings us to the big question, the one everybody wants to know. Is this swollen gland a big deal or not? Let's dive into how to read those first initial clues.
And let's just start with a super important number, just to set the stage and hopefully lower the anxiety level. When people go to their primary care doctor for swollen lymph nodes, less than 1% of those cases turn out to be from cancer. Less than 1%. The overwhelming majority of the time, the cause is totally benign. Your doctor also gets a ton of information just from a physical exam. See, a node that feels kind of soft, moves around a bit when you push on it, and maybe is even a little sore or tender, that usually just means it's fired up fighting a simple infection. Now, on the flip side, the things that raise a red flag are nodes that are hard as a rock, totally stuck in one place, don't hurt at all, or feel like a bunch of them are clumped together. That's when a doctor will want to take a closer look.
So how exactly does a doctor figure all this out? Well, you can think of it like a piece of detective work, where they're gathering clues to solve the mystery of what's causing the swelling.
And you might be surprised to hear that the investigation usually doesn't start with a bunch of fancy, expensive tests. Nope. The most powerful tools right at the beginning are surprisingly simple: a good conversation about your medical history and a careful physical exam. Your story is one of the most important pieces of the puzzle.
Your doctor is going to ask some really specific questions. They'll want to know, how long has this lump been around? Are you having any other symptoms, like a fever or night sweats? Have you traveled anywhere interesting? Been around any animals or gotten any weird bug bites? What kind of medications are you taking? And a really big one, is it just in one spot or are glands popping up in totally different parts of your body?
So based on all those answers, the doctor basically sorts the situation into one of three buckets. The first bucket is diagnostic, meaning the cause is super obvious. You've got a raging sore throat and a swollen gland right under your jaw, case closed. The second is suggestive, where the signs are pointing to something specific like mono that just needs a quick test to confirm. And then there's the third bucket, unexplained, and that's where the real detective work begins.
So what are all the things that could possibly be the culprit? Let's run down the list of the usual and maybe some of the more unusual suspects behind swollen glands.
Okay, number one, by a long shot, is your body fighting off some kind of infection. This is the reason for most swollen glands, period. We're talking everything from a common cold virus to the Epstein-Barr virus that gives you mono, or a bacterial bug like strep throat. Even things like cat scratch disease can do it.
Now, besides infections, other things can get your lymph nodes revved up. Sometimes the immune system just gets its wires crossed and starts attacking the body's own tissues. That's what happens in autoimmune diseases like lupus or rheumatoid arthritis. And believe it or not, even certain medications or exposure to toxins can trigger a reaction.
And finally, we have to talk about the one that's least common, but the most serious: cancer. Now, this can happen in two main ways. It can be a cancer that starts in the lymphatic system itself, like lymphoma, or it can be a cancer from somewhere else, like the lung or breast, that has spread to the lymph nodes. And this is exactly why a proper, thorough evaluation is so important.
All right, so what about those cases that land in the unexplained bucket? When the answer isn't obvious, how do doctors finally solve the mystery?
The game plan for these unexplained cases is actually very logical. If it's just a single swollen node in one spot and the person doesn't have a lot of risk factors, the doctor will often just say, let's watch it for 3 or 4 weeks. A lot of times it just goes away on its own. But if it doesn't, or if the risk seems high right from the start, they'll move towards a biopsy. Now, if the swelling is generalized, meaning it's all over the body, the investigation tends to be a bit more extensive right away, often involving blood tests and imaging.
When washing and waiting, or other tests still don't give a clear answer, there is one test that can. It's considered the gold standard for a reason, a biopsy. This is where a doctor takes a tiny piece of the lymph node itself so it can be looked at under a microscope. It's the only way to get the final, 100% definitive word on what's going on.
Okay, that was a lot of information, I know. So let's boil it all down. What are the absolute key things you need to remember from all of this?
So here's the bottom line. First, remember that most swollen glands are totally harmless. Second, if you find swollen glands in 2 or more different areas of your body, that's something you should always get checked out. Third, location really matters. Most are in the head and neck. Fourth, your personal story, your history, is the absolute key to figuring this out. And finally, for many simple, low-risk cases, a wait-and-see approach is often the best first step.
Now, I want to leave you with one very specific, very important clinical takeaway. There's a particular spot where a swollen lymph node is a major red flag, right above your collarbone. It's called the supraclavicular area. Because of where it's located, it drains fluid from deep inside your chest and abdomen. So swelling there is taken extremely seriously and pretty much always requires an immediate and thorough investigation.
When it comes right down to it, a swollen gland is just a signal. It's your body sending you a message. And most of the time, that message is simple. Hey, my immune system is on the job fighting something off for you. By understanding what these signals mean, you can turn down the volume on the alarm and just be aware. Your body is always communicating. The only question is, are you listening?